Welcome, my name's Ethan Kuss, and you're going to be joined by my colleagues in this video. This is the Modern Media Marketing Strategic Marketing Proposal for Arrow Health. Now I want to make sure you're paying attention, so listen carefully and see if you can pick up on the key themes throughout this proposal.
The key problems here include brand awareness, brand positioning especially in the private hospital setting, marketing opportunity, separation from substandard operators, wage or cost control, and also pricing and growth.
The internal analysis, we broke it down into a business model canvas, stating the key partners, key activities, key resources, value propositions, customer relationships, channels, customer segments, cost structure, and revenue streams.
The key segments were identified. There were 4 core groups: the courts and law enforcement, commercial with businesses with employees or leadership team members struggling, individuals and families, as well as international clients, specifically the American group. Now, Arrow is operating in a mature market. This means in order to stand out, there needs to be innovation, which Arrow has done to differentiate themselves from the competition.
A social media campaign. They will target the healthcare professionals, families of those affected by drug and alcohol addiction, and individuals affected. The channels we'll use is a social media platform optimizing the unused YouTube and LinkedIn channels. The 2 platforms we have decided to use are LinkedIn and YouTube. The YouTube campaign will begin off with a series of videos describing the success stories of different patients that stay at the center. During these videos, they'll begin with the patient sitting on a chair with a white screen describing how they ended up with Arrow Health. Then they will progress to speaking about how Arrow Health helped them before and after their stay and how healthy they are now. The aim of the campaign is to bring in the audience by seeing how someone's low can easily make it their way to their peak. The series will have 3 different videos.
The initial video will be a patient and his or her success story. This will then be followed by a doctor or counsellor who helped them out of their addiction. And finally, the 3rd video will be a family member describing their story with their loved one and how they found help with Arrow Health. These will prove to be extremely successful and beneficial as it directly targets all 3 segments and will play on the emotional chords of said segments, then bringing them all in for more inquiries at Arrow Health. Additionally, these will be shared on all social media platforms in order for them to reach their peak potential, as well as having sponsored and organic posts. The LinkedIn campaign's timeline will work on a similar level to the YouTube campaign. The LinkedIn campaign will work to target the 3 segments once again, aiming towards mainly healthcare professionals, but also those affected by drug and alcohol addiction and the families whose loved ones are affected by drug and alcohol addiction. LinkedIn was chosen as its avenue is ripe for market positioning and generating referral partners. By getting healthcare professionals involved with Arrow Health on LinkedIn, we will be able to guarantee a larger percentage of referral partners, which will then lead to more inquiries and admissions of patients. LinkedIn has also been relatively untouched by other rehabilitation centers, so we'll have a lot of space to position ourselves as the top market competitor. The LinkedIn campaign will be based around several different articles, similar to YouTube's campaign, which will involve the point of view from a patient, a family member of a patient, and a doctor. These stories will provide our healthcare professionals and the other 2 segments with statistics as well as relatable stories, so that they can decide if Arrow Health is the right choice for them. Additionally, these articles and the YouTube series will also be posted on Arrow Health LinkedIn, combining both campaigns so they can work cohesively. These posts will be organic as well as sponsored to see what is working best for Arrow Health. Implementation table referenced in the report. The social media campaign is broken down into extreme detail. However, below are the main aspects of the campaign that will be implemented to ensure success. 1. Source success stories that are willing to feature on the campaign and prepare articles for LinkedIn. 2. To design mood boards for the success story and prepare to start filming content. 3. To film and edit the stories whilst completing the articles for LinkedIn. 4. Create 2 specific segments for both YouTube and LinkedIn separately, the segments by age, location, and interest. In order to successfully segment these 3 markets, we will need to evaluate current audiences that are finding large throughout large web searches and thirdly inquiries. 5. Publish the campaign on LinkedIn and YouTube, paid posts as well as organic for the 3 segment markets. And finally, control and monitor how the campaign is going, this being done through listening to the competitors and consumers' engagements, likes, comments, and shares. The monitor and control by listening to consumers and competitors through likes, engagements, and shares and comments. Additionally, we will monitor and control other platforms to see how they're working as well. And finally, the budget. We'll have $500 for sponsored and paid posts on LinkedIn and YouTube while the campaign runs its course, and human resources, which will be our intern featured in Tactic 2, will also account for daily social media evaluation and maintenance.
According to the profit and loss table, the total employee expense per month is around $130,000. And according to the brief, one of the several problems Arrow Health now facing is the rate or cost control and also price or growth problems, etc. So my tactic is to join forces with leading universities. For example, Royal Melbourne Hospital is one of the clinical schools of the University of Melbourne School of Medicine. Co-branding with well-known university can raise consumer awareness of their brand and can also raise consumer expectation. Of course, the position is not limited to the brand awareness issue, but there are also marketing issues now facing to Arrow Health. So another aspect is to get business school student volunteer to develop true marketing strategy and find out the marketing opportunity through Arrow Health. The main step for this tactic can be broken down into following points. First is starting, of course, with getting in touch with the universe and explaining the program for volunteer opportunity. After approved, information is released within the campus and personnel are screened. After that, for in-depth discussion with program tailored to qualified personnel. And to summarize this tactic, first, the tactic provides financial help to Arrow Health and brand awareness and other aspects. But on the other hand, one of the biggest problem is the novice, because students are often inexperienced before, so there may be psychological breakdown in dealing with ethics.
Our last proposed tactic is a tried and tested strategic marketing technique, used often by law firms. It is a highly effective way to, at a fraction of the cost of traditional marketing, increase visibility and generate leads. This is by writing blogs. Now, specifically, the proposed strategy is to write professional articles to be posted on the website and further distributed through the LinkedIn and newsletters. The tactic is critical for the scaling of Arrow. Competing in a mature marketplace, there is a lot of competition, and innovation as Arrow has done with its program with forward thinking needs to be highlighted. The featuring of their cutting-edge thinking generates massive brand awareness, with so many individuals, especially within the American market, looking for something different. The article will boost exposure and Arrow Health's SEO ranking globally, leading to more attention on an international scale, which will mean exponentially more leads for the business. Arrow Health being able to tap into the American market gives them huge future upscaling if they can continue on this trend. Although addiction advertising is restricted, hospital advertising through Google AdWords is not restricted. Therefore, they are able to market their private hospital and links to other organizations such as the courts and law enforcement. The result will be far greater SEO ranking because although they are not able to advertise the addiction articles, the algorithm will draw the connection between the hospital, ads, and the articles on addiction together. Now, because those articles are being referenced in research and other professional articles throughout the web, Arrow's credibility and trustworthiness in the eyes of the algorithm goes up. This means that no matter what someone Googles in relation to private hospitals or addiction, Arrow Health will be appearing at the top of the Google search list. This also helps to differentiate themselves between the substandard operators out there. Now, these Arrow articles appearing in more places across the web is vital for their vision. Their vision being to inform, that is to combine the family-run business with the family-focused operations. By writing these articles and progressively being seen as an industry leader, their learnings will be introduced into schools, workplaces, communities, and law enforcement for the purpose of influencing policy. Furthermore, it positions Arrow as industry experts and leaders in the accessibility and high-quality AOD treatment services for individuals and families suffering from the effects of alcohol and drug addiction. The action steps are simple: writing 2 articles per month, one at the start of the month and one mid-month. Leveraging the superior SEO to generate exposure and visibility for far more leads, which will result in an improved conversion rate overall. We have designed this proposal to be able to be implemented with immediate effect. starting as soon as September 2020 if desired. Designed to avoid the effects of the global crisis currently, building on the momentum already established, for example the high occupancy rate. The pathway of implementation has been laid out over a 6-month period. First up was social media. It can be implemented immediately. For the university partnership implementation, conversation starts now in September, meaning that you can have interns coming into the business as early as January 2021, SEO and blog articles. September, the processes can start being planned, setting aside 4 to 7 hours for that one article's production, and you can have the first article being produced mid-September. So did you pick up on the core elements of the proposal? Let me tell you what they are. They are all doable with immediate effect. They are all cost effective, both financially and from a HR perspective. They are all tried and proven methods based in theory and case studies from huge brands around the world. They all offer real solutions to the problems and challenges that Arrow Health faces, growing their brand awareness, positioning themselves as leading experts in their field, and driving an increased conversion rate. And crucially, they all facilitate the upscaling of the Arrow Health business which is so desired. Solutions meet Arrow Health's mission and vision, as well as critically in a reliable way, scaling up the business stably, short and long term. Thank you for your time and consideration with this proposal. If you have any queries, please reference the associated report or contact us at any time.